Welcome to the Cardiovascular Pathophysiology Lab. As we go through these various images of gross pathology specimens, I'd like you to think about what types of physical exam findings might be present, what might we see on diagnostic tests such as radiographs or echo, and what might we do with this type of case as well. The focus is on the pathology specimens, but let's think about the clinical applications as well. So the first case is a dog that has mitral valve dysplasia. This is a young dog that eventually succumbed to congestive heart failure. So the left ventricle and left atrium are opened up, as well as the aortic outflow tract, aortic valve and aorta. The left ventricle is dilated, the left atrium is markedly dilated, and if we concentrate on the mitral valve leaflets, they're not attached to the right place on the annulus. The chordae tendineae are in abnormal location. The mitral leaflet attaches almost directly to the papillary muscle without an appropriate chordae in the middle. And the anterior mitral leaflet on the right-hand picture is markedly thickened and tethered to the wall of the left ventricle, so it won't be able to move normally as well. So as you think about murmurs and clinical findings, again, this typically would be seen in a young dog, usually a large breed dog. It can happen in other species as well, and mitral valve dysplasia can be seen in cats. Typically, there would be a murmur over the mitral valve location on the left side of the chest near the cardiac apex. And if heart failure developed, it's usually going to be left-sided congestive heart failure with pulmonary edema. We'll look at the next one. These are images from two different dogs. The dog on the upper left has hemangiosarcoma, and both the instrument and the blue arrows point to two different areas of hemangiosarcoma. One of those is at the tip of the right auricular appendage, and the other is a little lower in the body of the right atrium near the junction of the right atrium and the right ventricular free wall, closer to the AV groove. In the lower right panel, there is this dog also has hemangiosarcoma. This is a different perspective from outside the heart, and the green arrow points at a large mass attached to the right auricular appendage. Again, this is one of the more classic locations for cardiac hemangiosarcoma, is a mass attached to the right auricular appendage. So what might we see in a case like this? What are the clinical findings? We might see pulses that are weaker than normal or pulsus paradoxus, muffled heart sounds. On radiographs, a globoid cardiac silhouette. We might see metastatic disease in the lungs. On echo, we would be able to identify pericardial effusion in most cases. These masses are hard to image if you don't have pericardial effusion. And pericardial effusion could lead to cardiac tamponade, which might lead to collapse, or it might lead to right-sided congestive heart failure. Our next set of images is from three different dogs, all with dilated cardiomyopathy. The left-hand panel is an necropsy specimen from a Great Dane with dilated cardiomyopathy who had marked cardiac enlargement, dilation of all four cardiac chambers. And on this particular one, our orientation is to have the left auricular appendage up towards the top, left ventricle, RV, and RV outflow tract with the pulmonic valve, and the right auricular appendage curling around from the front. The middle picture is a short axis view through the aorta and left atrium from a Doberman with dilated cardiomyopathy. The aorta generally does not change in size, so as heart disease progresses, the left atrium gets bigger and bigger and bigger. So that relationship between aorta and left atrium can be used to judge the size of the left atrium. And on the right-hand panel, we have a long axis slice through the left ventricle, left atrium, mitral valve, and right ventricle of another Doberman Pinscher with dilated cardiomyopathy, showing dilation of all four cardiac chambers, some atrophy of the papillary muscle, thinning of the left ventricular free wall. So again, try to think about what kinds of findings might be present in these animals. You might identify cardiac arrhythmias, atrial fibrillation or ventricular arrhythmias or atrial arrhythmias. An S3 cardiac gallop is commonly seen in dogs with dilated cardiomyopathy. And dogs can have either left-sided heart failure, right-sided heart failure, or biventricular heart failure. The next case is from a dog with tricuspid valve dysplasia, with the right ventricle on the bottom and the right atrium towards the top. The heart's opened up, and you can see the trabecular pattern in the right atrium, as well as abnormal chords in the right ventricle. The papillary muscle attaches directly to an abnormal tricuspid valve. Tricuspid valve dysplasia is typically seen in young dogs. Certain large breed dogs are predisposed, including Labrador retrievers, maybe Weimaraners. Classic physical exam findings might include a right-sided systolic murmur over the tricuspid valve, jugular vein distension, hepatomegaly, and ascites. These two pictures are from a dog with severe pulmonic stenosis. There is opening of the right ventricle and the pulmonary artery. The region just below the pulmonic valve on the left-hand image shows some fibrous tissue. So this dog likely had both valvular and subvalvular pulmonic stenosis. There's also impressive right ventricular free wall hypertrophy noted in width by the yellow double arrow head. And on the right-hand panel, you can see the markedly thickened pulmonic valve. Pulmonic stenosis is typically a congenital lesion in dogs. Certain dogs are predisposed, including terrier breeds, English bulldogs, French bulldogs, pit bulls. German shepherds can get the disease as well. Common clinical findings for pulmonic stenosis include a loud, harsh systolic ejection quality murmur on the left heart base over the pulmonic valve region. If there's right-sided heart failure, there might also be a murmur of tricuspid regurgitation, jugular vein distension, hepatomegaly, or ascites. Some dogs eventually develop right-sided heart failure with ascites, and others develop syncope or collapse as a result of inability to pump blood through the lungs and get the blood to the left heart, and inadequate blood flow then goes to the brain. Cardiac arrhythmias can also be seen and may be a contributor to sudden death in dogs with pulmonic stenosis. The pulmonary artery has an area of a jet lesion that can be seen near the red arrow. These two photographs are from a dog with tetralogy of Fallot, and findings include marked right ventricular hypertrophy, a ventricular septal defect that is high in the intraventricular septum, an aorta that is moved to the right or dextro-positioned and overrides the interventricular septum, and pulmonic stenosis. The right-hand panel highlights the pulmonic stenosis, where you can see the markedly thickened RV wall and a thread that's in the cavity of the right ventricle going through the RV outflow tract past the narrowed pulmonic valve into the main pulmonary artery. Tetralogy of Fallot can be seen in many species, including dogs, cats, horses, and ruminants. Tetralogy of Fallot often leads to a significant murmur, either on the right cranial sternal border as a result of the VSD or at the left heart base as a result of pulmonic stenosis. Because unoxygenated blood from the right heart makes it into the systemic circulation, this can lead to reduced oxygen delivery to the kidneys, release of erythropoietin, stimulation of red cell production, and eventually polycythemia. Polycythemia can contribute to collapse, or it can lead to thrombosis, or it can lead to abnormal neurologic signs as a result of sludging of blood in the central nervous system. These images are from a dog with severe subaortic stenosis. Note that there is significant thickening, concentric hypertrophy of the left ventricular free wall and the interventricular septum. There is also a post-stenotic dilation of the aorta. The aortic valve is a little bit thickened, but the main lesion is below the aortic valve in the subvalvular region. This thick area of fibrous tissue here is the lesion of subaortic stenosis. This lesion causes the pressure in the left ventricle to rise in order to pump blood out into the aorta, which is the resulting concentric left ventricular hypertrophy. Physical exam findings often include a harsh systolic ejection quality murmur that can be heard well at both sides of the chest, at the heart base, and weak arterial pulses. While dogs with subaortic stenosis can develop congestive heart failure, sudden death during exertion or exercise is more common. Sudden death may occur as a result of ventricular arrhythmias. Electrocardiographic findings can include a left ventricular enlargement pattern, ST segment depression, or ventricular arrhythmias. This dog had a large mass inside of the right atrium that was partially occluding the tricuspid valve. A biopsy was not done, although this might have been myxoma. This heart is from a cat that had hypertrophic cardiomyopathy, and you can notice the thickening of the left ventricular free wall as well as the papillary muscles. The interventricular septum is in close opposition to the anterior leaflet of the mitral valve, and this can sometimes lead to obstruction to blood flow from the body of the left ventricle out into the aorta. If the mitral valve moves towards the septum in systole, this is sometimes termed systolic anterior motion of the mitral valve, and that can lead to turbulence in the aortic outflow tract and secondary mitral regurgitation. This turbulence may be the cause of cardiac murmurs, and cats with hypertrophic cardiomyopathy might have a cardiac murmur. The cats with obstructive disease are more likely to have a murmur than the cats without obstructive disease. If heart failure develops, it often is left-sided heart failure earlier in life, and later on cats may also develop biventricular heart failure with large volumes of pleural effusion and jugular vein distension. An additional auscultatory finding in cats with hypertrophic cardiomyopathy is an S4 gallop that occurs because the heart is stiff when the atria tries to contract into the hypertrophied ventricle. This specimen is also from a cat with hypertrophic cardiomyopathy. Notice the impressive thickening of the interventricular septum and the left ventricular free wall. The mitral valve in this case is also in close opposition to the interventricular septum. This cat has a markedly enlarged left atrium and left auricular appendage. And the enlarged left atrium can sometimes lead to thrombus formation, especially in the left auricular appendage, which is the common site for atrial thrombi to originate. These serial transverse sections through the heart of a cat with cardiomyopathy identify both right atrial enlargement and left atrial enlargement, and this cat had congestive heart failure. The walls are neither dramatically thickened or thinned, and contractile function was slightly reduced but not low enough to term the cat as having dilated cardiomyopathy. There is an area of thinning of the left ventricular free wall by the blue arrow between the papillary muscles, and this may be a localized area of fibrosis or could have happened as a result of a prior myocardial infarction. A number of cats are identified to have cardiomyopathy with an absence of clear valvular disease or other cause for their heart failure or cardiac enlargement. And sometimes these cats have unspecified cardiomyopathy, or they may have restrictive cardiomyopathy. These two images, looking from the left ventricle and the left atrial side, are from a boxer that probably had cardiomyopathy but had a loud murmur. And in the age before echocardiography, the thought was that the mitral valve may have been the cause of the congestive heart failure. And indeed, it may have been that this particular boxer had quite a bit of mitral valve disease as well. You'll see that the mitral valve has been replaced with an implanted mechanical valve. This valve was implanted by Dr. Ross, who's a distinguished professor at the Cummings School. This is a picture from patent ductus arteriosus dog, and the instrument travels from the aorta through the PDA into the main pulmonary artery. The PDA connects the aorta and the main pulmonary artery, and since the pressure is higher in the aorta than the pulmonary artery, blood flows from aorta to the pulmonary artery in a continuous fashion. This leads to a continuous heart murmur, heard best high in the left axillary region. PDA can also be seen in cats, horses, and alpacas. Typically, the left ventricle and the left atrium become enlarged, and this places a volume overload on the left ventricle as it has to pump both one blood volume to the body and an extra blood volume through the PDA. On thoracic radiographs, this often leads to cardiac enlargement in addition to pulmonary overcirculation with enlargement of both pulmonary artery and vein, as well as an interstitial pattern in the lungs. Another physical finding is bounding arterial pulses, which is a result of diastolic runoff of blood from the aorta through the PDA into the pulmonary artery. It's another picture of a dog with patent ductus arteriosus, and the probe goes from the aorta through the PDA into the main pulmonary artery. Again, physical exam findings might include a continuous cardiac murmur at the left heart base, as well as bounding arterial pulses. The PDA, as well as the accompanying cardiac enlargement, can usually be imaged via echocardiography. Surgical repair and/or use of a catheter technique to occlude blood flow through the PDA is strongly recommended. This is a picture of a dog that had both subaortic stenosis and bacterial endocarditis. The aorta has been opened up and we're looking down on vegetative lesions on the aortic valve. Subaortic stenosis in dogs predisposes them to the development of endocarditis, although endocarditis is a rare condition in most veterinary species. Endocarditis, when it affects the aortic valve, can lead to both stenosis and insufficiency of the valve. In this case, with the aortic valve, we might hear a systolic ejection quality murmur due to narrowing through the aortic outflow tract from the vegetation or from the subaortic stenosis. And if there's sufficient leak at the valve, regurgitation, then we might hear a diastolic decrescendo murmur. Dogs with bacterial endocarditis often have systemic signs of illness, and laboratory findings can include hypoalbuminemia, altered liver enzymes, azotemia, or a high or low blood glucose. Complete blood count changes can include leukocytosis, left shift, monocytosis, or thrombocytopenia. Blood cultures are usually the best way to try to identify the organism causing bacterial endocarditis. This picture is from a dog with heartworm disease and Cavell syndrome. There are many worms in the cavity of the right ventricle. In dogs with Cavell syndrome, the worms can bounce back and forth from the right atrium into the right ventricle across the tricuspid valve. This often leads to a right-sided cardiac murmur. Heartworms usually live out in the main pulmonary artery, but they can be induced to move back into the right ventricle or the right atrium. Many dogs with heartworm Cavell syndrome have significant pulmonary hypertension. Radiographic findings can include right heart enlargement as well as enlarged pulmonary arteries that may be tortuous or blunted on their distal end. Some dogs can also develop right-sided heart failure. The worms cause destruction of red cells as they traverse back and forth across the tricuspid valve, and this can lead to hemolysis and hemoglobinuria, as well as coagulopathy. The appropriate intervention for dogs with Cavell syndrome is to surgically remove the heartworms from the right ventricle and right atrium. This specimen is from a dog that had myxomatous mitral valve disease or endocardiosis of both the mitral valve and the tricuspid valve. The valve leaflets are thickened and curled and nodular. The left atrium is enlarged as a result of mitral regurgitation. Dogs also usually get left ventricular enlargement. The thickened mitral valve and mitral regurgitation results in a regurgitant quality murmur heard best at the left apex of the heart. If there's sufficient mitral regurgitation, this can lead to left-sided congestive heart failure with pulmonary edema. The leak at the valve can cause a jet lesion on the endocardial surface of the left atrium, and some dogs have chordae tendineae rupture or endocardial splitting of the wall of the left atrium which if it becomes a full thickness split can lead to cardiac tamponade. This is a dog with esophageal entrapment due to a congenital malformation at the heart base, a vascular ring anomaly. Persistent right aortic arch is a common cause of this problem, and young dogs, as they're being weaned to solid food, start to have problems with regurgitation. Notice the dilated esophagus in front of the vascular ring anomaly. This specimen is a dog, a Labrador Retriever, that had both pulmonic stenosis and tricuspid valve dysplasia. The pulmonic valve is thickened and dysplastic. The right ventricular free wall is markedly hypertrophied as a result of the pulmonic stenosis. Concentric hypertrophy of the right ventricle develops. The tricuspid valve is abnormal in thickness and is also downward displaced. This created tricuspid regurgitation and resulting significant enlargement of the right atrium. This dog thus had problems with both a pressure overload to the right heart and a volume overload, and this combination is often poorly tolerated. This can lead to right-sided congestive heart failure with ascites, or it can lead to syncope or significant arrhythmias, especially atrial arrhythmias, can develop. Dogs with pulmonic stenosis often have a systolic ejection quality murmur, loudest at the left heart base over the pulmonic valve. Dogs with pulmonic stenosis often have a right ventricular enlargement pattern on their ECG, and the degree of hypertrophy and the severity of stenosis can often be estimated from echocardiography. This cat had cardiomyopathy and has some atrial enlargement. It's notable for the extensive network of false chordae tendineae, sometimes referred to as moderator bands, in the left ventricle. Normally, chordae tendineae traverse from the papillary muscle to the atrioventricular valve. And this cat has some normal chordae tendineae, but there are additional false chords or abnormal chordae tendineae spanning the cavity of the left ventricle. This was originally described as moderator band cardiomyopathy, but we see these false chords or extra chordae tendineae in a variety of forms of cardiomyopathy. Whether these chords have any contributing role to diastolic dysfunction is unclear. They may just be an innocent bystander seen in cats with various forms of cardiomyopathy. This heart is from a dog that had atrial septal defect, actually 2 atrial septal defects. The first one is in the middle or higher location of the interatrial septum, in the secundum location, so perhaps termed a septum secundum type defect noted by the blue arrow. And there's a second atrial septal defect by the yellow arrow that is low in the interatrial septum, sometimes referred to as a primum septal defect. This second defect is located just above the tricuspid valve. In some animals, this defect can affect the atrium and also cause a high ventricular septal defect and cause an abnormal formation of the mitral or tricuspid valve. And when all of these are present, it can be called a common AV canal defect. The picture on the right has an instrument that's been placed through the AV canal defect on the right side of the heart and is seen entering the left atrium close to the mitral valve. This dog died as a result of severe thromboembolic disease to the pulmonary arteries. The yellow arrow points to a very large thrombus present in the main pulmonary artery and the branch pulmonary artery. The dog had heartworm disease many, many years ago and had seemingly recovered and then developed thrombosis of the pulmonary artery. The right ventricle is both dilated as well as concentrically hypertrophied. The thrombus created secondary pulmonary hypertension, which then resulted in a pressure overload to the right ventricle, causing the concentric hypertrophy. These hearts are from dogs that had a heart-based tumor. The tumor typically originates from the aorta, often from the chemoreceptors, and is often a chemodectoma, although sometimes thyroid carcinomas also occur in this location. These tumors are common in brachycephalic breeds, including boxers, bulldogs, and Boston terriers. The mass can be found as an incidental finding in some older dogs, but as the mass grows, it can start to create problems. One of the things that can occur is pericardial effusion with cardiac tamponade, and this can lead to either collapse or right-sided heart failure. Another thing that can develop with large masses at the heart base is compression of structures at the heart base, including the pulmonary artery or the pulmonary artery branches, or compression of the left atrium or the pulmonary veins, or even the cranial cava. These tumors are often relatively benign and less likely to metastasize than some other neoplasms. In dogs that develop pericardial effusion, you may identify muffled heart sounds, weak pulses or pulsus paradoxus, and the ECG may show evidence of low voltage QRS complexes, electrical alternans, or ST segment changes. Echocardiography is very helpful to both image the mass and see whether it might be compressing structures, and to identify whether there's pericardial effusion or cardiac tamponade. This picture is from a dog that had atrial standstill due to atrial muscular dystrophy. The dog felt ill as a result of a slow heart rate from the atrial muscular dystrophy, and a permanent pacemaker was placed. This disease is characterized by progressive loss of atrial myocytes, and you can see how thin the wall of the right atrium is as light is transilluminated from one side to the other. This leads to a loss of P waves and often a relatively slow heart rate. In this dog, a pacemaker was placed from the jugular vein, and the lead went through the cranial cava, through the enlarged right atrium, across the tricuspid valve, and into the right ventricle. So we're pacing the right ventricle. This dog eventually developed refractory heart failure with enlargement of both the left atrium and the right atrium, as well as enlargement of the left ventricle. Heart failure medications were helped to keep the dog comfortable for a number of years. This is an example of arrhythmogenic right ventricular cardiomyopathy, which when it occurs in boxer dogs is also called boxer cardiomyopathy. ARVC can also occur in bulldogs, some other canine breeds, as well as in cats and in humans. The right ventricle is significantly enlarged, and there are large pale areas of the right ventricular myocardium where the myocytes have been replaced with either adipose or fibrous tissue. This is a classic finding in ARVC, loss of RV myocytes and replacement with fibrous or fatty tissue. Sometimes the disease progresses and affects the left ventricle as well. Clinical scenarios can include syncope, collapse, or sudden death, and later in the disease process, congestive heart failure might develop. These arrhythmias, typically ventricular arrhythmias, are the cause for the collapse, and they can be identified on ECG or Holter monitor recording. Thanks for watching the show.